Neurological Assessment using a Glasgow Coma Scale and the NIH Stroke Scale. These assessment tools are used to evaluate the patient's level of consciousness and to identify signs of stroke or neurological impairment. This assessment is important for early detection and timely medical intervention. For eye-opening response, first, I will assess eye opening. Face the patient and ask, "Sir, Mom, please open your eyes." Then observe the response. If the patient opens eyes spontaneously, score is 4. If the patient opens eyes to verbal command, score is 3. If patient opens eyes to pain, score is 2. If there is no eye opening, score is 1.
Ngayong gabi, ma'am.
Ngayong gabi, Isad.
Kamusta man, ma'am?
Okay ra.
Wala may ginabate.
Wala.
Naalang ko i-assess sa imo ha, ma'am, no? So, ma'am, pwede ni mo i-ablihan ni mo mata kay naon lang.
Next, second is the verbal response. I will assess verbal response by checking the orientation of the patient. We ask the patient's name, where are you right now, and what is month today. Then, we evaluate the response. If the patient is oriented to person, place, and time, score is 5. If confused conversation, score is 4. If inappropriate words, score is 3. If an incomprehensible sound, score is 2. If no verbal response, score is 1.
Pwede ni mo i-state imong pangalan, ma'am?
Ako di ay si William Cristalianes.
Kabalo ka unsa po'y adlaw karon, ma'am?
February 25.
The third one is motor response. Now, I will assess motor response of our patient. Tell our patient to squeeze our hands and raise her arm. Then, observe the movement. If the patient obeys commands, score is 6. If localizes pain, score is 5. If withdraws from pain, score is 4. If abnormal flexion, score is 3. If abnormal extension, score is 2. If no motor response, score is 1.
Pwede ni mo i-squeeze akong amot, ma'am, itlay. Sige, i-squeeze. Tapos mag-anak ka mo, ipagahit mo. Sige. Isa pa. Sige, isa ka. Pwede ni mo masaka imong kamot, ma'am.
The Glasgow Coma Scale interpretation. So the total of Glasgow Coma Scale score is obtained by adding the eye, verbal, and motor scores. So a score of 13 to 15 indicates mild brain injury. A score of 9 to 12 indicates moderate brain injury. A score of 8 or below indicates severe brain injury and may require immediate intervention. The NIH Stroke Scale is a systematic assessment tool used to measure stroke severity. It evaluates level of consciousness, vision, facial movement, motor strength, coordination, sensation, speech, and neglect. The total score ranges from 0 to 42, with higher scores indicating more severe stroke symptoms. So for the level of consciousness, you can ask the patient or the person, "Sir, Mom, can you hear me?" Then observe if the patient is alert, drowsy, or unresponsive.
Mudunggan man ko ni mo tarong, ma'am, no? Dili man lang.
And for the LOC questions, we can ask the person, "How old are you? What is month today?" Then assess the orientation.
Kabalo ka unsa po'y adlaw karon, ma'am?
February 25.
For the LOC commands, we can ask the person, please open and close your eyes, please squeeze my hand. Then this checks the ability to follow simple commands.
Yes, pwede ni mo i-squeeze ako ang kamot, ma'am. I-try. Sige, i-squeeze.
Fifth, the visual fields. You can ask the client, tell me how many fingers do you see? And you can ask also, are to test both sides of the visual field, because this checks for visual loss. For facial palsy, we can ask the person to smile, also to raise her eyebrows, and to show her teeth, because these observe her facial droop or asymmetry.
Smile daw mo. Ma'am, saka ni mo yung eyebrows, ma'am. Iana naman.
The motor arm, you can ask a person, please raise your right arm and hold it for 10 seconds. Now raise your left arm and observe for arm drift or weakness.
Saka mo ang left hands, ma'am. Sige, pikas pod. 5 seconds po siya. Sige, thank you.
Motor leg, please raise your right leg and hold it for 5 seconds. Now raise your left leg. Observe for leg weakness.
Sige, ma'am. Isaka mo ang legs. Isa ka buo. 3, 4, 5. Pikas pod, ma'am. Okay, thank you.
Limb Atasha, please touch your nose, then touch my finger. Repeat on both sides. Then, this checks coordination.
Ilong, ma'am. Akong kamot, ma'am.
For sensory, we can use anything like ball pens to touch their skin, then ask the person, do you feel this? Lightly touch both arms and legs. Then ask also, do you feel this? Then, because this checks for sensory deficits.
Ana, mapil mo, ma'am. Dali na lang.
Opo.
Hindi man sakit.
Hindi po.
For language, show objects to client or show a picture, then ask her, what is this? Or can you describe what is happening in this picture? Because this assesses for aphasia.
Saan siya, ma'am?
Brain.
So for the dysarthria, we can ask the person, please repeat after me. For example, the rose is red. Then observe for slurred speech.
Rose is color red.
A rose is called red.
NIH Stroke Scale Interpretation. So a score of 0 indicates no stroke symptoms, 1 to 4 indicates minor stroke, 5 to 15 indicates moderate stroke, 16 to 20 indicates moderate to severe stroke, then 21 to 42 indicates severe stroke. Three of these, the Glasgow Coma Scale assesses the patient's level of consciousness, while the NIH Stroke Scale evaluates the severity of stroke symptoms. But both tools are essential in neurological assessment to ensure early detection and timely management.